for COVID-19 in the United States. What that means is the number of people who are infected is close to 2,000. That's the latest number, but it was rising fast. And the number of people who have died due to the virus has exceeded that which they were recording in New York on a daily basis. So it is true that Louisiana is pretty soon to take over from New York. Well, the reason they're thinking that the infection rate is so high in Region 1 in Louisiana is the Mardi Gras, which took place February 26, had 1.5 million people visit New Orleans and the French Quarter particularly. And if you remember, the virus was first identified in Wuhan on January 11th. So for 6 weeks, whatever kind of traveling contagion possibilities had passed, and there was still that many people in New Orleans for Mardi Gras. So it is really looking like the number of people infected, perhaps during that gala, is starting to be realized in the form of sickness. And it is definitely overwhelming the medical system in Region 1 of Louisiana.
I was down in the Mardi Gras, a few years back, and we stayed down in the quarter, down in the French Quarter. Our hotel was there, right where they have all the stuff at. And we weren't there tonight. We were down there for a convention, and that's a pretty tight place, and it's hard to avoid people down there. So I would think that
if you're in Louisiana, you're not trying to avoid. That's why they call it the Big Easy. And what happens in New Orleans is pretty much your own business. So yeah, closeness, dancing in the street, all kind of party, and a close dynamic is the rule rather than the exception. So the potential of spread during that time is very high, and we're now realizing it currently. The other thing that's a pretty big, if you want to call it a debacle, Ochsner Hospital System, particularly in Region 1, has a very stronghold of healthcare, and they were saying 16 health care persons were exposed to corona virus, and so they had to quarantine those 16 plus a series of other healthcare workers. And if you start making your healthcare workers sick, who's going to take care of the infected? So that's a big issue and question mark of how is it going to be handled? Are we going to start asking National Guard healthcare personnel to step in? How are we going to screen? So it really is a major issue right now in Louisiana.
Well, up here, they have just no more than I say a few minutes ago, they have begun to start interviewing some of the healthcare workers, and I got to tell you, Dr. Boles, it was quite frightening because a couple of the doctors, they were women, and they came on and they were crying at the I mean, it was really scary. They were crying because of they were frightened by their not knowing that these people had the CORONO, and that this is what they were saying, and that they were told in the beginning that these people may have been just have the flu or some other benign virus, and now it's coming out that people that they have this other, that they have the CORONO and they're not protected, and this is what they were saying. They said they felt they weren't protected, and some of them started watching some of the things from the Ebola, and they saw that the medical people had on hazmat equipment, and they would talk about some of these other things like some kind of mask that has a ventilator on it, and they were talking about all of that, and then one of the doctors, she was sitting in her car. She said she sleeps in her car because she doesn't want to go home and infect her children.
Okay, so, I'm back. I'm ready to introduce. We're ready to introduce the show, Doug.
Okay, get started. Go.
You're telling me to run with it?
Run with it. Go. We're ready.
All right. And this is the Wisdom Table coming in from the Grand Houses Community Radio, based in New York City, Harlem, USA, 123rd Street and Amsterdam Avenue. I'm Brother Leroy, co-host to the Wisdom Table team. And today's guest is a young lady who we are always going after for information, and that's Dr. VELBA Boles. And first we have to say the program, the Wisdom Table, does not reflect the views, attitudes, whims, deeds, or any other proclivities of the resident members or the leadership of the Resident Association of Grand House. Neither does what you hear on this show reflect the views or any other inclinations of the management of this NYCHA development. However, the program does reflect the research done by the participants in the program for live and living color. And there's always you, ladies and gentlemen, brothers and sisters, boys and girls, the first-class citizens of the world. We thank the Most High for blessing us with the opportunity to bring you information, and always remind you, don't believe anything you hear on this show, but if you listen to it, you're obligated to do research on your own and build on the knowledge. And if you find something that's incorrect, come back at us and we will pursue that. But once again, our guest is Dr. VELBA Boles of Louisiana by way of North Carolina. And we're talking about COVID-19, and her perspective, her insights are extremely valuable. Dr. VELBA Boles, thank you for joining us this evening.
Thank you so much for having me. I look forward to it.
Let's start with the fact that you have interviewed a number of times in Louisiana and have gotten a lot of feedback from folks who have been saying what you had to share needs to be in a broader arena. And so this effort on the part of the Wisdom Table is to do just that. But what are the key points, before we get into a ABC linear interview with you, but what are the key points, let's say 3 key points that folks have brought up to you that they had not heard before on the general media, your feedback from the interviews in Louisiana?
Number one that I want to mention is toilet paper has no role in COVID-19. And those of you who are buying it and hoarding it, I don't know where you got the idea. The major question I've been asked that's relevant is how can we build our immune system so we can be more resistant to this virus? And I think that's something that we need to discuss. But before I go into that, I want to mention Black America, that's the area that I know best, have the highest incidence of diabetes, high blood pressure, renal dysfunction, and dialysis. All of those types of conditions are what they're talking about when they say compromised immune system. So I'm repeating it because in the state of Louisiana, the highest incidence of those conditions are among Black Americans. So if you take it a step further, everybody is quoting senior citizens are at high risk. Well, I need you to add to that list that everybody who has what we refer to as a comorbidity, which are diabetes, hypertension, acute renal failure, dialysis, those also make you very susceptible to a bad outcome if you should get COVID-19. Now, with saying that, and Black Americans have the highest incidence of those comorbidities, what everyone should be asking the Black community is how do we protect ourselves since we are at equally high risk to senior citizens? I haven't heard that question, but I'm going to volunteer some information. The foods that I have seen being purchased by my Black comrades are snacks. There are cookies and potato chips and all kinds of such as that as they begin to quarantine and stay at home. Those foods will not help protect you against getting the infection. In fact, high sweets and high calorie foods can make you more susceptible because your immune system will be worse compromised. The foods that can help you would include fresh fruit, particularly citron like lemons and oranges and grapefruit. Apple skin, not just the apple, but the peel of an apple has antioxidants. If you're really serious, you need to be buying onions and bell peppers because those are the things that help protect you against viral attachment. So I'm watching that we're just sort of doing business as usual, but we're at high risk. What is another food? Sardines. It's not expensive, but it has one of the highest protections with vitamin A and all kinds of special oils that creates a very good immune boosting. Notice the word boost. So what we need to be doing to prepare for this long-term quarantine, and unlike what 45 is saying about April 12th, it's not going to be over at April 12th. We may just be peaking out. And the saddest thing that I'm going to say, I have no way, I don't have a crystal ball, but I am afraid that in the Black communities or the poor communities, this is going to be like a wave, and the incidence among the poor and the Black is going to be late April, early May. Why am I saying that? Because primary care doctors right now are the ones who are recommending people to get tested. If you don't have a primary care doctor, that means you're not going to get tested anytime soon. And if you don't know you're having the virus, it has a chance to become very aggressive, and you have a chance to spread it around in your community. So my first opening comment is to please be aware what you eat does matter. And if you intend to protect yourself, you need to start looking at the foods that boost your immune system. So that would be my opening comment on what most people have been asking. And I just shudder at some of the foolishness, buying toilet paper and cookies and potato chips and cheese puffs, when you should be very concerned with how can I live through this crisis and not have to be put on a ventilator.
In terms of the folks who are at risk, there is news of younger, or actually children, babies, a couple of instances having succumbed to COVID. And the question is the number of vaccines, inoculations that they're given at birth. How might that impact on their being big victim to the virus?
Okay, it's really a two-part answer. No vaccine that's being given to any child at any age will protect them from COVID. I want to say that up front. How can I say that so conclusively? We don't have a vaccine yet against this virus. So what you're getting is the regular stuff. That's the B. We're trying to protect from hepatitis B. We're protecting you against Haemophilus, which is a type of influenza or pneumonia that babies can get. But those vaccines are against what is already known, and we know how to treat it. The second part of that is the reason children are not so highly at risk. Children, or very young children, aren't in the environment that gives rise to infection. And this is why I did the shout out about protect your community. Children under the age of 6 don't go by themselves to Walmart or a mall. They're not the ones that flush the toilet when they use it. They're not the ones who grab the door when they walk in. So their likelihood of being in an environment where the virus is available to them is very low, except in school, where you sit next to your comrade, you eat lunch next to your comrade. And the second exception is riding a school bus, where you sit near your friends, and that's why they closed the schools. So they would reduce the likelihood of a child being in an environment that would have coronavirus. Now, if daddy's sick and mommy's sick or big brother's sick or auntie is sick, now that child can get exposed. There is no evidence that a child is any better at fighting COVID-19 than an adult, but their likelihood of being exposed is lower. And we should understand that. And I was speaking earlier before you came on with your producer who were saying how healthcare workers are afraid. Many healthcare workers, my sister's a nurse supervisor, they are afraid to just come straight home. Many of them are taking precautions, putting on shoe covers and making sure they shower or change their clothes before they come back into their home. And that's the reason. If you are walking around in a hospital or a clinic, someone who has COVID comes in and sneezes, and that sneeze is sprayed to the floor. If you walk on the floor, you can actually pick up the virus on your shoes. Or if you sit where someone else has sneezed, caught it in their hand, and placed their hand down on the seat, and you sit behind them, you can pick up the virus. So I think that Americans get a bad idea saying what can't happen when they don't understand the process, how it happens. Children are not the first line because they are unlikely to be in the environment, but you can end up creating that environment that makes them at higher risk.
Okay, let's go to the basic foundation of understanding COVID. What is a virus? What is bacteria? And just how, it being on the surface, what's the dynamics of picking it up and transferring to one's face, etc., or to someone else?
Well, the first comment to be, I've had people say, is it man-made? Coronavirus is not man-made. In fact, it's one of the oldest viruses on Earth. There are many families or genuses of coronavirus. In fact, the one we know most is the common cold. Common cold is a coronavirus. Influenza is an adenovirus. So as you can see, there's many different viruses, and there are many family members in a single class of virus. In the class of coronavirus, the one we're familiar with, as I mentioned, is common cold. And what is happening with COVID-19, this virus has not infected man to this extent ever before. And that's why they call it new. That's why they call it novice. This virus is new to man. It is not new to science. It is not new to animals. If you did veterinary medicine, you know about this coronavirus. You may even have animals to have died with this coronavirus. People were saying, oh, this is researched and they have samples of it. Answer is yes, but it was relevant to the animal kingdom and not to humans. And when it's an animal virus, the research that we're doing now is not done. We wouldn't be manufacturing ventilators for an animal. So people who are trying to say it's man-made and it's introduced, they're wrong. Does it have a catalog number? Possibly. Does CDC have a sample? Possibly. But it doesn't have anything to do with the rate of infectivity that we are witnessing. When they first talked about a virus or any kind of a virus, many people, when they're thinking virus, we make a generic term and we say germs. When we say germs, that includes everything: bacteria, viruses, parasites, amoeba. That's a generic term. It's a lay term. It's not scientific. It's not medical. If you're trying to get an understanding of this process, you have to get into the science. A virus is a non-living particle. And everybody says, I don't understand. I give the analogy of a grain of salt. If you took a salt shaker and shook it out on the table, and the smallest grain you could pick up on your finger, you pick it up and look at it, this would be the best example of a virus. This particular non-living particle is made of either RNA or DNA. Now, many of us know about DNA because of all the genetic stuff and 23andMe and all of that. And if you watch CSI, you can track people on DNA. Well, a virus, if it's made of DNA, that good example would be a herpes virus. A number of viruses are made of RNA. Either way, it is a non-living crystal, just like that little grain of salt. Now, how it works is when this little granule is placed on a moist living cell, like in your nose. As you know, when you have a runny nose, we have mucus. We make mucus in our nose. In our eye, we have tear production. So any surface of moisture, the eye, the nose, consider your mouth. You have saliva. So any moist surface, if this grain of salt were to touch, you would taste the salt, or the salt would burn your eye, or the salt would burn your nose, because the moisture in those places allows that granule to attach. And that's the key word, attachment. When this virus attaches, it can get through into your cell, the living cell. Once it gets into the living cell, it hijacks it. It's like a hijack of a plane. Whatever that cell was supposed to do, it doesn't do it anymore. The DNA or the RNA starts to tell the cell, gives the cell new orders. And the primary thing that the virus does is it tells the cell to replicate it. So one virus gets into the cell, but it may have it replicated 1,000 times. And when that cell has replicated this virus 1,000 times, it explodes, it bursts. And that's when you have the fever, the headache, you start feeling tired, you may feel a little nauseated, and that's in the early stages. Once the 1,000 viruses now is in your nose, in your throat, you get a sore throat, you may get a stuffy nose, you may have an itchy eye, and if it invades more cells, now you went from 1,000 viruses, 10,000 viruses, 1,000,000 viruses. Now this is where your immune system comes in. If you are healthy, your body knows what to do when it has an invasion, and it starts doing its job. It will produce lots of mucus. That's why you get a runny nose when you have a cold. Children, they get real croupy. Sometimes they have a dirty nose, as my grandmother would say. It'll look crusty and whatever. You will have phlegm in your throat. You can't keep clearing it. You're trying to get that. You sneeze. That's your upper airway trying to thrust this virus out. All of those are considered normal immune response. The issue is that when you sneeze, the virus can fly out on some of the saliva. And everywhere that sneeze lands is like putting more grains of salt for somebody else to pick up. And that's what we call communicable. When we say community, oh, it's now communicable man to man or human to human, it means that if I sneeze, and even if I touch it with my hand, if I grab the doorknob and you come behind me, when you touch the doorknob, guess what? You picked up one of those little granules, which if you touch your eye, touch your nose, or your mouth, you are now infected. The face mask, if you sneeze, is caught within your mask. It didn't spray all over the room. Or if you're wearing a mask and you walk in a room where someone has been sneezing, you don't inhale any of those particles out of the air. So that's why what we call the PPE, or personal protective equipment, is so important. So if someone comes into an emergency room or into a clinic and they sit in a waiting room and they're sneezing and coughing, and you walk in as the doctor and you don't have a mask on, you will be breathing in or touching surfaces that could be covered with the spittle that happened when that person was sneezing or coughing. And that's how it spreads.
Okay, the bacteria.
Now, when you say bacteria, coronavirus is a virus. Now, if you want to talk about a bacteria, we can say pneumococcus is a bacteria. A bacteria is a living entity. It literally has all it grows, it multiplies, it reproduces, and it is a bacteria. And when we have a bacteria, we can give you an antibiotic because an antibiotic can interfere with the growth of a bacteria. Some antibiotics will stop it from getting bigger. Some antibiotics will stop it from dividing. So antibiotics, we can treat bacteria, but antibiotics have no effect on a virus. And that's why viruses are not alive.
Okay, bacteria, there is such a thing as good bacteria.
In your gut, in the human body, we have probably 3 trillion bacteria in our gut, and it lives with us in what we call a symbiotic way. You may hear terms like E. coli, that is a normal bacteria in our gut. On our skin, the surface of our skin, we have staphylococcal, we have strep. Teenagers, when they have real oily skin and they start getting pimples, most of the time that's just a staph infection because of the skin having so much nutrient oil and the bacteria overgrows. So humans have what we call symbiotic bacteria or good bacteria. Otherwise, we would not be able to digest most of our food. And when you hear people talking about prebiotics, what they're really telling you is, here, eat this like yogurt and other kinds of food, sauerkraut, kimchi. And what that does is it increases your good bacteria. And the good bacteria can strengthen your immune system.
Okay. All right. Okay, now, how is it explained that something that is said to have started in Wuhan, the city in China, how is it explained that it now is in most parts of the world outside of China?
Oh, it's easy. It's called an airplane. It's called a cruise ship. See, it used to be if someone got sick, it would take 3, maybe 5 days for anyone to travel to any far distance place. But you can take less than 24 hours to go from Wuhan to San Francisco or New York City or Chicago. And those are the hot spots, the big airports. The San Francisco is the biggest airport receiving Chinese visitors, second only to John F. Kennedy, which is in New York City. Third is Chicago, O'Hare. So if you look at where our hot spots are, they're exactly where our big plane services are. So people can move around today in less than 24 hours. So if I picked up some kind of a bug, I don't feel sick yet. So I get on the plane and I fly to San Francisco. Maybe when I get off the plane, 12 or 15 hours later, I may not feel 100%. But when I got on the plane, I didn't have any symptoms. Where it used to be, if you had to take a train or a slow boat or a car, in the 2 or 3 days of your travel, you know you are sick. But today, you can literally be sick and don't know it. Or by the time you find out, you could have been on another side of the world. You can travel 7,000 miles.
Okay, how is it explained that they say individuals can not have symptoms and give this thing off to others? And the question that comes to mind is the eventuality of that person allegedly sick with COVID, not getting sick, or eventually they're getting sick.
It's called a carrier state. And for the listeners, if you've never heard of it, there's a famous case called Typhoid Mary. Mary in the 1800s was a cook. She used to go to the railroad in different places and cook for 2 or 3 weeks for the different men that worked on these railroads. Well, Mary got typhoid fever. It didn't kill her. Typhoid kills a lot of people, but Mary didn't die. She became a carrier. And you say, what does that mean? That means that you have the infection, but you feel fine. But whenever you urinate or go to the bathroom or sneeze, the infection will come out of you and someone else come in contact with it, they get sick because they don't have the resistance that you do. So carriers are dangerous. The story for Typhoid Mary, she literally was arrested and was held for, I think, 31 years. She died at age 84. But they say that because of her, close to 3,000 or 4,000 people were killed. Because she'd come into a town or into a camp, and the people would all get typhoid, and many of them would die, and she'd move on to another camp. So carriers don't feel it. They're carrying it, but it doesn't make them sick. Doesn't cause their lungs to clog up with pneumonia. And that is what they're saying they're trying to avoid, is not to introduce it into the community and end up having someone who is a carrier. Because if you feel good, you keep right on doing what you're doing, but you can be leaving a trail of infection.
Okay, so that's where testing comes in?
Yes, and they're just now saying, I was very upset when I first heard what they were doing. They would tell you, call your primary care doctor and talk to them, and they can refer you to get a test. And then they started setting up testing centers. And they say, do not come to the testing center unless you have a fever of 100.4, or you have a dry cough, or you have shortness of breath. And I was saying to anyone who was listening, that is ridiculous. If you're only testing people who already know that they're sick, then you are not testing the right group. You need to test anyone who is facing people. You need to be testing your grocery checkout person. You need to be testing whoever's handling restaurant food. They should be your first line because they can spread and not know they're sick. They're running around saying, if you're already sick, come and get tested. And I'm saying, no, you already know they're sick. Please test my mailman. They're going to touch my mail. Test the person in the kitchens. Every restaurant should have had an immediate testing of all of their workers. All of the hotel service people should have been tested. All of my healthcare workers should be tested. One question came up today when I was watching on one of the programs. They said, if a healthcare worker tests positive, does that mean every patient that they saw now has a chance to have it? The answer is yes. And I'm saying, so does it make sense that person is in a too high, if you're in a high contact position, that should be our first line of testing. And if you can find that you got everybody in your post office, in your restaurant, why would you tell me to do pickup, order my food and pick it up and don't know if the cook is sick? Why would you tell me I can go to the grocery store and my checkout person touching every object I put on the checkout belt, she's going to touch it, and I don't know if she's sick? You see what I'm saying?
Yeah, I hear what you're saying.
It's just weird to me. The thinking that we did was backwards. It's like, test the sick people. Okay, now go ahead to Walmart and buy your goods. Like, what if that checkout person is sick? And I put 20 items on the counter, and she's going to touch all 20 of them. And then I'm going to go home and touch them again. And then when somebody wants some cereal that I bought, they're going to pick up the box and touch it. So it just seems like, I'm
sorry, what is your understanding of the testing that has happened in South Korea and South Korea? What is your understanding of that?
So here's how right now, and I've told some very close friends, this disease is going to show America's underbelly. And what I mean by that, things that we hide by talking about how wonderful we are and how you only see the good things that we brag about, the ugly stuff is going to come out. The homeless people are not going to be taken care of. In California, they're trying to put them into different places. I talked to a homeless man here in Alexandria, and I had to smile because when I speak to some of my street people, they're so intelligent. He said to me, I am afraid to go to a shelter. He says, in a shelter, they put us about 5 or 6 inches apart laying on these cots. That would be a place for me to go and catch it and die. And I couldn't say anything because you know what? That's exactly how we space it. We put them in like sardines. We don't give them a standard of living. We crowd beds in. But if the homeless get it, we're going to be in big trouble, because who's going to track them? How do you track a homeless person? And if you quarantine somewhere, what does quarantine mean when you have nowhere to go? So I don't hear these questions answered. I know San Francisco is trying to do it, and they've opened up some recreation halls, and I think some churches that was closed by mandatory closure, and they're putting homeless people in. But you can't, I mean, you put them in there, but are you giving them 3 feet apart? How do you tell us we have to have social distancing, but how we treat our homeless is as if they don't need the same kind of thing?
Okay, so let's back up in terms of looking at it from another perspective. The perspective being that we're running a country or a city, and we're confronted with this virus. What would be your approach, your recommendations, your consultation with the mayor or the leaders who are involved in running that particular area? What, in given the same situation, dealing with incarceration, dealing with homeless, dealing with low-income folks who don't have the foods to sustain themselves for even a week?
Well, you know, that's a good question for me, because I've given this a lot of thought. First of all, when you quarantine someone, you have to know the lay of the land. And I'm going to do this as a shout out in general. Black neighborhoods, they call them food deserts. We don't have supermarkets. If there were a major quarantine according to a neighborhood or a location in Alexandria, Louisiana, we would have Black neighborhoods that would not be able to feed themselves, because we do not have supermarkets in our area, and we don't seem to understand what foods we need to buy to be safe for 2 to 3 months if we are quarantined. If I were in charge, the first thing I'd worry about would be mental health, because I know I'm shutting schools down. I'm telling them you can't go to church. There are people, family members stacked on top of each other, and we don't always like each other. So my question that I've already put out to 2 of our government agencies: why is there not universal internet? They keep talking about you can go online and do this, you can go online and do that. 48% of the people in Alexandria don't have internet. So you close the schools, and the kids who have money and whose family have internet, they can, go online and keep getting their education. But what happens to the poor? What happens to the Black that don't have internet? So my big thing is, if you're going to get a stimulus, keep your city up to par. Go and rent, talk to HughesNet, talk to Bluebird, talk to whoever have satellite internet, and make sure that every citizen has access to internet so you can communicate with your people and keep them safe with up-to-date information, and not let it get into a free-for-all, because people are relaying information and they're doing a bad job. So number one, secure your neighborhoods with internet. It is now 2020, it is possible. We have enough satellites up in space that no one should be without internet. Just like every home has electricity and running water, we need to have internet, and now is the time to do it. Number two, we need to, as it recently happened, tell all of our manufacturers, you are not making cars. I'm tired of seeing commercials talking about brand new 4-wheelers and RAV4. How are you trying to sell me a car when if I go to work, I don't have a face mask or a gown? We should have already commandeered our manufacturing agencies to provide PPE for all of our healthcare workers, our nursing home workers, so that they are safe. Number three, testing. Anyone in a public sector who's handling food, dispensing food, or police officers in contact with people, they're front line to be tested. They must have a test on a regular basis, not once and then that's done. Maybe every 2 weeks we check. Does that teller or that grocery store person, are they still healthy? Is the postal worker still healthy? Is the person in the cook place still healthy? That is how you start a real public health prevention. Number two, the indigent. Right now in Alexandria, we have to come to the realization that if schools do not supply food to our children, they will be malnourished. And I am ashamed of that. They have to open the schools twice a day to give breakfast and lunch to the children who otherwise would not have adequate food with schools being closed. Now that's bad enough. But also in Louisiana, we've gotten back to busing. So children do not have neighborhood schools. Therefore, when they're in this crisis saying, okay, at 9 o'clock, we're going to give sack lunches, and these schools are the ones we're giving sack lunches. Well, if you don't bus the children to that school, how are they supposed to get there and pick up that sack lunch? We no longer have community-based schools. So I'm saying, how stupid is this? So you're giving out sack lunches because the poor people need to eat, and you give them no means of transportation to get to it. Then when you have groups of kids walking together in gangs to go from wherever they live, 2 miles, 3 miles from the school, then they're breaking the rule of social distancing. Planning, poor planning, poor planning. If you're going to give food, why don't you open a community center and give out breakfast and lunch? Why are you giving it out at school, pretending or acting as if the kid gets to school on their own? They ride buses. So if you're not going to send the bus and pick them up, why are you dispensing the food at their school? So planning right now is episodal, it's hit or miss. They're reacting as my grandmother said, they're running around putting out fires. That, okay, now we need this, let's do that. But they're not looking at it in a strategic manner. Someone who plays chess, or good as my dad would say, a good checker game, you have to look several moves ahead. If I do this, then what happens? And once you look at the then, you say, okay, if that happens, how am I addressing it? That's not at all what's been going on. It's, oh, I think it's going to be over April 12th, or we got plenty of respirators. And meanwhile, people are dying and getting sick. There was a report that at Ochsner Hospital System, 16 young doctors were exposed to COVID-19 because they did not see patients with protective gear, and every one of the doctors they associated all have to be quarantined. So how are you going to run a hospital if your first line of defense is being wiped out right from the start? How smart is that? So the big thing is planning, and Bernie Sanders was shouting it all during the campaign. We have no national health care. For president, for your number 45 to appoint the vice president as a spokesperson for COVID was a joke. We have a Surgeon General. We have people qualified to launch a strategic approach, and they're totally being ignored. They'll say, well, he told me this. I don't want to hear what somebody told you. I want to hear it from the person who knows. There's questions out there saying, if I'm pregnant, do I need to worry about this? Zika, we found back in the summer 2 years ago, actually passed the placenta, and mothers were having babies with small heads. I don't know if you remember that, the Zika virus that was in Brazil. Right now, mothers are asking, will this affect my baby? Does this pass through the placenta? And nobody's even talking about it. I haven't heard one person address what should you do if you think you have COVID and you're also pregnant. There's been questions saying my child has asthma. Do I still give them treatments, respiratory treatments, or should I stop? I've had people ask, I take blood pressure medicine. We know that certain medicines like Lisinopril and Acropril, it works on the lungs. Should I continue taking it with the COVID risk? You don't hear these discussions. It's like everybody's sitting around watching and waiting. So
I need you to go back. Go back to patients taking particular medications and they having certain effects. Just play some of those out.
I know I get talking fast. High blood pressure, one of the number one treatments with cardiovascular treatment, and particularly also with diabetes, because that's also a cardiovascular disease, is Lisinopril, Acropril, anything with the last term pril, P-R-I-L. It is a medication that's given that helps theoretically to lower blood pressure. And many diabetics are on that medicine. We also know that any of the prils, the way it works is it works against something called angiotensin. Angiotensin is a hormone that is found in both the kidney and the lung. And the question, and this was among doctors, see, patients don't get to hear this, but the doctors were saying, since we know the prils interact with this hormone in the lungs, would people taking this medicine be at a higher risk of getting this virus, since this virus targets a receptor in the lung? And they talked among themselves back and forth. Well, we know that lisinopril can cause a cough, and we know lisinopril can make you hoarse, but there's no evidence. Now, translation means no one yet has gotten sick from it. We haven't seen enough people die from it, because evidence means I got to see it and not predict it. And I don't think that's the good way to practice medicine. I shouldn't have to see harm being done before I can say, you know what, let's do this instead if we have an alternative.
So Doc, look, what we've been getting, consumers, is that the high risk people are the aged, people are diabetic, maybe even renal dialysis, kidney dialysis. But they've not, what you just said, pointed out, is that it's not that a person is diabetic, is that the medications they may be on would provide a better arena, or a negative arena, a better arena for the virus to take hold. That's a discussion.
And you miss it. That is what we call a compounder. See, people who have diabetes, see, the way in which America talk about diabetes, you think it's a disease. Diabetes is a syndrome, and it affects every endocrine organ in your body. It affects your vessels, it affects your liver, it affects everything. So your immune system, because of diabetes, first of all, is low. That's why you see people get amputations. If a person with diabetes cut their foot and it doesn't heal, they end up amputating that foot. If you or I cut our foot and we're not diabetic, we don't worry about amputation so much. The reason the diabetic has a high amputation rate is the body does not launch a very strong immune response. It doesn't heal well. Well, if you know that you don't heal well, then you know that anything that would compromise your healing will also compromise your ability to fight an infection. So if you get the virus and you're diabetic, that same slow immune response can cause the virus to overwhelm your body. That's the first attack. If you are taking medication that prevents the lungs from being able to resist the attachment of the virus, that's attack number 2. So you have what we call a compounding situation.
Okay. Jumping around before we go to a very key question that folks are asking this who are listening. They say, how come she knows so much? So we're going to get to that in a minute. Vitamin C, a news report indicates that here in New York City, they're giving high doses of vitamin C to some folks who have this COVID-19. What is happening in the body when it gets high doses of vitamin C and the person has COVID-19 or said they have COVID-19?
Vitamin C is like your cavalry. Ascorbic acid energizes a lot of enzymes. It can rev up, if you like. People out there drive cars. My dad used to put a fuel supplement in the car, and he said it will help clean the pistons and it'll make the car run smoother. Vitamin C is used by so many enzymes in the liver, by so many enzymes in reproduction of bone marrow and red blood cells. So what you may not know, brother, is that many Americans are deficient in vitamin C. We do not eat the greens, and when we do, the nutritional value is low. So if you start with a low situation of vitamin C and get an infection, you rapidly use it up. So if you use up what little bit you have in the moment you need it the most, it's all gone. So the treatment, when you hear the holistic doctors or Ayurvedic doctor talking about tonics and teas, they are boosting things like vitamin C, like rose hips will give you vitamin C. We have been lulled into believing orange juice is the best thing, and that is absolutely wrong. Why? We put sugar in orange juice. When you buy the commercial juices, they squeeze it and then they sweeten it. Anything that is high sugar is not ideal when you're fighting for your life. So vitamin C, if they're giving high dose, I say, I'm very glad to hear that. Kudos, because what they are doing is telling, so you have two kinds of immunities. One is called innate. And what innate means, and this is genetic, innate means you got a tough constitution. I know my dad used to talk about it. He said, no, give me a dose of castor oil. I'm going to be all right. What he's saying is, just let me clean my system out. Let me get some rest and I'm going to beat this. Then you'd have someone else, they can't get to lift their head off the pillow and they're whiny and they can hardly stand it. Their constitution or innate immunity may be poor. That can be genetic. Sometimes children are born with weak constitution. What we used to do is give them cod liver oil or let them drink what we call pot liquor. When we boiled our greens, our collard greens, we gave them sardines and other kind of foods to build their constitution. So innate immunity says we have a natural aggressive immunity. But if you get overwhelmed, say like with virus, now what you need is supplementary support. And that means antibodies. And that's where vaccines come in. That's where certain kind of medicines like vitamin C can boost the liver in killing things off. Vitamin C can boost your immune secretion from the gut. So vitamin C is kind of like the cavalry. It's a refresher. That's why you hear people say, take vitamin D. Vitamin D will tell your red blood cells in the bone marrow, we need more T cells, we need more monocytes. And they're like cheerleaders, if you like. They come in and boost you. It's a booster. So your innate immunity says this is what you're genetically able to stand. Your secondary immunity is what we can encourage. We can encourage it with food. We can encourage it with vaccine. And some people can do it mentally. When you say, oh, someone says she had a cancer and she goes into meditation and go back 2 weeks later and the cancer's gone, there's proof that some people can use their mind to boost their immunity. So many of us who have innate immunity just says strong constitution. But when you start talking vaccine and ginger and onions and vitamin C and elderberry, that's your secondary immunity. I'm trying to boost it. So
okay,
yeah,
so
excellent idea.
okay. Let's go to that part of the introduction of Dr. VELBA Boles, who's in Louisiana, ladies and gentlemen. And we did not ask her background. We went right into the matters at hand. So share with us your background that has enabled you to share with us some of the information that you're doing tonight.
Okay, well, before I jump into my studies, let me just tell some people what they may not know. Many states in the United States will not allow physicians to do what I'm doing. When you get your medical license, there are certain terms that a state can impose on you conditionally in holding a license in that state. And some states require that a physician cannot speak out against another physician. Others specify we must be pro standard of care, meaning whatever Harvard and John Hopkins and other big institutions say is a correct standard of care. If we deviate, then we are in fracture of our agreement in being licensed in that state. My background for training, I'm very proud of the medical training I received from University of Pittsburgh. And I graduated in 1989 with my MD. And during the time I was there, Tom Starzl was doing the famous liver transplant. So there was a lot of notable things going on, and the education there I'm very pleased with, and I rely on that heavily since I've left. I did residency training at Tulane Medical Center in New Orleans. I did internal medicine and pediatrics. And I did trauma training at the University of St. Louis. Trauma training is your ER kind of support. So I got my ATLS through University of St. Louis. I worked at emergency rooms all over the state of Louisiana. The primary emergency room was in Breaux Bridge, Louisiana. I opened clinics as part of the Tesh Action group, which was a group that was before Governor Jindal in Louisiana that opened clinics in rural small cities all over Louisiana. And we have some extremely rural areas in Louisiana. Since the clinical days, I was a hospitalist at the Veteran Hospital in Alexandria Pineville. So I've worked in clinical, I've worked in hospital, I worked in ER, and then I moved to administration. I was medical director at a hematological center where they extracted plasma and other things for hemophiliacs. I've been a medical director at several nursing homes where I work with senior citizens. And currently I work on a number of advisory boards where I confer on hematological issues and oncology issues. So I'm self-employed. I do not have a hospital that I must do grand rounds with. I do not have a staff of meeting unless I call it. And I enjoy the freedom of going to continuing medical educations all over the nation and the world. And I maintain what was stated to be 150 CMEs a year was recommended if you wanted to stay on top of your game. And I do it because it's my pleasure.
Your degree from the University of Pittsburgh, is that it for?
Yeah, my undergraduate was North Carolina State. If I want to shout out to Raleigh, North Carolina. I did a master's degree in chemistry at Duquesne University before I went to medical school. And I did the MD PhD program at University of Pittsburgh, with most of my PhD graduate work being done at Colorado State in Fort Collins, Colorado, where I also worked with the CDC there in Fort Collins for a year.
Okay, so, and you're the author of at least two books?
Two white papers, which one had to do with what happened with Hurricane Katrina and the water contamination and difficulties. One was on youth obesity, the epidemic. This was during President Obama's reign, when First Lady Michelle was trying to get moved. I worked with programs that supportive of that. And I have two editions of a book called Salute a Reaction, which describes healthcare and pharmacy ripoff of Americans, particularly Black Americans in the United States.
Okay, ladies and gentlemen, brothers and sisters, boys and girls, this is the Wisdom Table, coming to you from the Grant Houses Community Radio Station, based in Harlem, USA, Amsterdam Avenue and 123rd Street. And we thank the Resident Association for allowing us the opportunity to bring information to the broad audience that we're able to reach. And the Wisdom Table is a workshop. We have additional members who may have questions, and that would be our direct to Sister Esther. Are you available? Do you have a question? And also, Doug, if Doug has a question of Dr. VELBA Boles before I continue.
I do, Brother Leroy. Thank you for allowing us in. And I want to mention that Stu Reed is on it as well. And I think Esther has her microphone turned off. So, but my question to you, Dr. Boles, because we talked a little bit earlier before Brother Leroy came on about the medical people, when the doctor's sitting in her car crying about their inability to have this PPE or the professional stuff. But I wanted you to comment a little bit on there is now a Navy ship, a aircraft carrier that has been infected with the CORONO, and they're trying to figure out how to deal with it, along with also a ship that a cruise ship that left the harbor left New York, Miami in March 6th, and now they're stuck down in Panama, where 4 people have died on the ship, and they're trying to figure out how to get the people back in and into the place. So
Well, the
my question,
latest news that I saw today is they have a sister ship that's willing to take the non-infected persons off, because what they were able to prove earlier, if you remember, when they held the ship in port under quarantine, all they did is manage to infect more people on the ship.
correct.
The ship was not equipped to adequately quarantine the people. So you're absolutely right. They've had some death. They have 2 people, I understand, who have tested positive since the death. And they have a sister ship who is coming to disembark. So in other words, the healthy people are getting off the sick ship, getting on what could be a healthy ship. And I don't know where they're headed with the healthy ship, if they're going to be allowed to dock anywhere. But they are doing, in my opinion, the right thing by getting healthy people out of the environment that could be fully contaminated. I was not aware that the Navy has an issue with coronavirus. I did not know we have
Yes.
an aircraft carrier.
In fact, on the aircraft carrier, what they found was there on a particular aircraft carrier, and the way that the places that the sailors sleep, there's no social spacing. In fact, they kind of cramped together, and so they are now there. I don't know how they're going to deal with it, because now they're trying to rethink how they're going to use these aircraft carriers and all these other things. And I just want one other question before I turn it over to Stu or somebody else. How, in your opinion, I know you talked about the vitamin C as a part of it, but there was a doctor on TV earlier today, and there's been a lot of people from your profession on there. What would you recommend for us regular people, and particularly the people who are hypochondriacs? What would you recommend to them about when they should think that they had something, and do you think monitoring your temperature makes sense?
Well, viruses do not give everyone a high temperature. That's the issue. How your body reacts to a virus. Some people have cold chills. Some people will go into a sweat. Some people will just feel very tired and sluggish. And that's how the first signs. And then the second signs could be a sore throat, or you can't clear a frog from your throat. So the symptoms vary with the person's constitution. That's what I meant by innate immunity. If you are a strong constitution and you don't feel sick easily, you could be a carrier. You can be going around doing your regular day saying, yeah, I don't really feel great, but someone come behind you who has a poor constitution, and they can get very ill and possibly die. And that's why I'm saying testing of everybody makes more sense than trying to test only the sick. And the everybody testing should start with people who are in contact with others on a regular part of their job. That was what I meant when I said the grocery store person and so forth. But if you're at home and you don't have to be out in the world, and you want to say, what can I do to boost my immune system? Number one thing is stop drinking sugar drinks. Stop eating high carb foods like potato chips and corn chips and cookies. Those are not what you want to be consuming when a virus is on the lookout, because sugar, high sugar, whether you're diabetic or eating the sugar as candy and cookies and so forth, you are creating an environment that will give you less immunity. Foods that give you more immunity would include things like sardines, any kind of greens, mustard greens, collard greens, spinach. If you don't have money for fresh stuff, get the canned stuff. Just drain off the juice so it's not a lot of salt. But you can be boosting your immune system while you wait this out. You don't have to be gaining 10 or 15 pounds and loading your body with sugary drinks and heavy carb food. That would be a mistake. You're setting yourself up. For vitamin C, they have, I would recommend fresh. I like the grapefruits and the oranges. Orange juice is a definitely no. If you're buying the drink because it's orange colored and it's 90% sugar, it is a mistake. If you can't get the real thing, leave it alone. Or better yet, make your own lemonade. Buy your lemons, make your lemonade. But stay away from anything high sugar. And as far as how do you stop the virus from attaching, old folk remedies were onions, eat lots of onions, eat more peppers, include your garlics in your food, and you will be boosting your immune system.
I got one other question, Doc. Oh, shit. I got one other question, Doc. Sorry for cursing. What about if you have like children? What who I remember being a kid and taking that college stuff you was talking about. I hated it, and I would almost be willing to take a week.
Liver oil is a way of getting vitamin E in your system. Any kind of fish. I mean, it used to be when we were not so rich and bougie, we went fishing and we caught our fish and we grew greens in our garden. We grew our own onions and so forth. So food was just out the back door. Young kids today are at a disadvantage. They eat sugary cereals. They want the Fruit Loops and the Frosted Flakes. We're giving them cow's milk. Black children do not digest bovine milk very well. So if you're giving them bovine, which is cow's milk, they're going to have increased asthma. They're going to have eczema and psoriasis. They're going to be ADHD. And we follow what other people do without questioning. We're giving our children medicine for ADHD and then giving them Frosted Flakes and milk for breakfast. That's ridiculous. And I saw, like I said, I've gone around to the stores to see what people are buying. And just because they put it out front for you to see it, don't mean you should be buying it. I looked at all the different cereals. They're chock full of sugar and the dairy has gone down in price. And I'm saying, please, folks, use your common sense. This is not the food you eat when you are about to go into war.
You got a question for Dr. Boles? No. Okay. I also would like to know, then let me just ask one more question. I've noticed that in the supermarkets around here where I am, and even more importantly, I see a lot of the young people walking around in the neighborhood with no masks, no gloves, congregating, sharing their marijuana cigarettes. Do you think that's a recipe for disaster?
Well, again, I don't want to be a portender of doom, but what they're going to see is right now their innate, I keep using that word, immune system is protecting them. Once that crashes, they have no, I mean, they can die just like anybody else. There is no magic bullet. They are not shielded. They're really playing Russian roulette. And if they're believing people on TV saying, oh, if you're under this age, then I tell you, you're going to come to a horrible realization. And as my mother would say, I hate it for you.
Thank you, Dr. Boles. Back to you, Brother Leroy.
And Doc, in terms of talking about boosting and strengthening the immune system, what role does cleansing, the colon cleansing?
Excellent question. Actually, when I noticed, I gave you the analogy of a virus being like a grain of salt. If you use that in your mind and you say someone sneezes and they just sprayed salt, little particles all over the surface of whatever, the table, the seat, the handle. When you take, and the recipe I told people, if you ran out of hand sanitizer, don't panic. You can take 2 tablespoons of Clorox bleach or chlorine bleach, put it in a half cup of water and put that in a little spray bottle. And the reason I gave a recipe for a small amount, that's what I carry in my purse. I didn't go spend an extra lot of money trying to get hand sanitizers. It has been proven that a 10 to 15% solution of a chlorine bleach, and that's the recipe I just gave you, will dissolve. Did you hear what I said? Dissolve, destroy the viral particles. So if you make this solution and you spray your car handle before you get in the car, or you spray your hands before you get into the car, you will have destroyed, dissolved, eradicated any viral particles that was clinging to your hand. If you want to take a towel and wipe surfaces, spray it and wipe it down, you are in fact eradicating the presence of virus on those surfaces.
So, Doc,
That is the solution we used for HIV when I was in med school. We didn't know HIV was killing people, but I had to get out there and see people. But what we did is we sprayed things with a 10 to 15% Clorox solution to maintain the health.
So, Doc, I'm a slow learner. I need you to repeat everything you said about the solution.
I say 2 tablespoons of Clorox. The reason I'm giving it in a low dose and not cups and quarts and whatever, I want everybody to feel empowered. Get a cup, fill it half full of water. Take 2 tablespoons of a Clorox bleach, or even the cheap stuff. You can. All you want is hypochlorite, and that even the cheapest bleach is made out of that. You want 2 tablespoons of your bleach and a half cup of water. Stir it around. Transfer it to a spray bottle. And the spray bottle I'm thinking about, if you ever saw what they call a travel kit, the little clear bottle is about, I guess it's 5 ounces or less, because you can't get on a plane with more than 5 ounces. If you transfer the solution into a little spray bottle, you use that spray just like you use hand sanitizer. I use it more. I would spray, if I was going to go and pick up a glass, I spray the glass and wipe the glass off with my paper towel. If I'm in a grocery store and I have paid and I'm walking out, before I get in my car, I spray my hands because I do not want to transfer anything to my steering wheel. When I come in my house to put away my groceries, if there's something I want to wipe down, I might spray the box or the container before I put it on the shelf. It's easy to make. It's easy to replenish, and nobody can charge you $10 for it.
Oh man, this is the wisdom table, ladies and gentlemen. And what is your understanding, if at all, do you have of the involvement of Cuban doctors going into Italy, China, etc.? What do you know of that, if you know
Cuba
anything?
has a fantastic medical program. If I'm not mistaken, the Honorable Farrakhan at one time was advocating some Black people to go and train with the Cubans. They have a wonderful medical program. My understanding is they have top-notch doctors, and I think that's part of the proof to say, hey, look, we got people who can go to another country and perform. Now, I was very proud of that. I thought that was outstanding.
But in terms of the current involvement of those doctors, you're not up on that at this time.
Well, they're taking their supplies with them. You know, Italy was facing what everybody else has. Since Cuba does not have the same level of infection, the doctors are going with their own equipment, my understanding is. So they have their PPE.
Dr. Boles, we had another doctor on, and that doctor mentioned the idea of using interferon as a treatment. What do you think about that?
Well, right now, all of that is theory.
Okay.
There's interferon, there's tamoxifen, there's rifampin, there's I can list a dozen because they're all now experimental. Nothing to date has been shown to stop the big thing for this virus is attachment. You hear me use languages. One is attachment, another is invasion, and the third is replication. Those are the 3 different ways we can interfere with virus infection. The main line is attachment. If I can prevent it, and that's why you're washing your hands, That's why you don't want the attachment. Don't let the virus attach. If, however, you are working in a health area and you walk in a room where someone has been sneezing 15 times and the air is full of those little particles and you take a deep breath because you don't have a mask, they're already attached. So attachment is already there. Now what do you do? Well, the second thing is invasion. You don't want the virus to invade a living cell. Some people will use a neti pot. I think I may have talked about that. That's when you literally rinse your nose out. I don't know if anybody at the wisdom tables are familiar with the neti pot. It's N-E-T-I. So a neti pot can be used to rinse out the nostrils and prevent invasion. Taking lozenges like zinc, or gargling, like with my grandma would say warm salt water. Some people say Listerine. There used to be a spray called chloroseptic spray. The reason you'd be spraying in your mouth and throat is you're trying to prevent the virus from invading that tissue. So that's step 2. You can take lozenges, you can drink soft, gargles with Listerine, you can do salt water, you can do vinegar gargles. You're preventing the virus from invading. Okay, the virus invades. Now is when you have a fever. Now is when you're going to be hoarse, when your throat's going to be sore, and this is when you start coughing. The cough is the body's way of trying to remove this invasion. The bronchial tubes and bronchial cells know there's something foreign. That's why if you choke on food, what do? You cough. If you drink water the wrong way, you cough. It is the bronchial system's way of trying to get rid of something it knows that shouldn't be there. So when you're starting to cough and you're starting to have a fever, you've already passed attachment and invasion. You have now an infection. And that's why I was saying, if they tell you come when you got 100.4 fever, you got a dry cough, you already passed the first 2 stages. So being in the ER, during influenza season, I would take high doses of coenzyme Q because that's one of the immune boosters. I would increase eating of grapefruit. I like to taste without any sugar on it. And if I were to feel that kind of sore throat, I gargle immediately. I would start gargling because I know the steps. I'm trying not to allow it to get an infection. So that's the 3 ways a virus gets in. Attachment. So if you want to prevent attachment, clean the surfaces, wear a face mask. You want to invasion, you want to avoid invasion, wash your nostrils out with a neti cup or gargle with salt water. If you want to prevent infection, that's when you start talking about eating more onions. That's when you're talking about garlic, hot soup, hot teas. So there are 3 ways to stop a virus. And right now, we do not have a single medicine that is working to prevent infection. But you can do the first 2. Clean surfaces, cover your face. What are you doing? You're preventing attachment. Okay, you got exposed. How do you stop it from now invading? Gargle your throat if it's feeling a little bit sore. Start zinc lozenges. Put some honey and lemon hot tea. You're trying to prevent it from invading. So right now, we try to stop the virus from infecting us. And that's what's going on quarantine. That's what they mean by social isolation. You stay away from someone, the virus can attach because you're not close enough to get it. When they say, okay, wash your hands often. If you pick it up on a surface, wash it off without touching your eyes, your nose, or your mouth. So that's why viruses are so difficult. It's 3 possible ways we can stop it, but we don't kill viruses. We can dissolve it with chemicals if it's on a surface, but I don't have a medicine that kills it. I have to give you a medicine that prevents infection or prevents attachment.
Spanish flu. What do you know about that?
Wow, I just had a long conversation. In 1918, exactly 100 years ago, this is biblical to me, October 2019, 100 years after the Spanish flu, we have a new respiratory disease. The 1918-1919 flu killed 1/3 of the world's population, and we never found a cure. Did you hear what I said? No cure was ever found. It had a behavior, it was what we call bimodal. It infected, then it died down, and then it came back with a vengeance. More people died in 1919 than when it first, the infection was rampant in 1918. So the backlash, if you like, or the surge, the biggest deaths occurred after the first infection. If coronavirus follows that pattern, that's what the conversation was about, that by Easter or April 12th, as number 45 is talking about, we're getting back to work. No, folks, if you're poor and you're Black and you haven't been tested, that's when it's going to hit your community. And usually in the summer, it kind of goes down, gets a little quiet, and it comes back in a vengeance by October. Late September, early October is going to be chaotic. That's how I see it for 2020. And that's why I'm running around every venue I can to tell my people, boost your immune system, protect yourself. If they quarantine a Black neighborhood, guess what, folks? We have no grocery stores. They talk about food deserts. What would you do if National Guard does not let you leave your house if you got a whole bunch of toilet paper and nothing to eat? No, we need to be thinking about that now. They can say martial law. You can't cross this line, or you can't go in this part of the city. If one part of your city shows a low incidence and then they label your community as a hot spot and it's a Black community, we're in trouble. We don't make our own food. My young women know how to cook ramen noodles, and that's it. They don't cook greens. They don't cook this, and they don't cook that. They microwave. What happens if you can't get to the grocery store because you're under full quarantine? We don't have a backyard garden. So I don't see this going away anytime soon.
Doc, just go back over the Spanish flu, the ebb and flow of it. The
flu was first identified at the end of the year in 1918, something like October and November. And there were pretty much what we saw happen in Italy or in Wuhan. People they call it Spanish because it was in Spain. There was a bevy of people dying, and it went quiet. It killed off a bunch of people, and kind of, you didn't hear much for a while. But keep in mind, we didn't have jet planes, and we weren't flying around and shaking hands and whatever. And usually when we talk about respiratory disorder, in the summertime, we aren't inside as much. This is what people are banking on. In the summertime, school is out. That's why they close the schools. Think about it. School is out. Temperature is up. Kids are outside playing. People are outside mowing lawns or whatever. We're not closed in. Once we got back inside, late September, school is back in. We're back inside because it's cold out there. Then the infection rate got so high and so rampant, it just took off. And the thing that controlled the epidemic in 1919 was die out. So many people died that there was nobody to be infected.
Okay. I'm going down my laundry list. You mentioned something very briefly that's important to the audience, to Black people, and that is how church is a central component to our lives, not just from the standpoint of this is the habit of going to church, but in terms of mental stability. That's my assessment. Give yours.
I chuckle because we need to use common sense, and I don't advocate anyone not paying attention to what the rules are. But the one thing, and I speak to Black people because that's my cultural heritage. Whenever things got bad, we run to the church. Look at 9/11 after the planes flew into the towers. Look how church assembly became important. When government tells you you can't go to church and you're in a Black neighborhood, and you don't have a way to express yourself spiritually, I that makes me uncomfortable, because we don't have a lot of places where Black people have authority. Church is one of the few places. You have a Black minister, you got Black deacons, you got Black ushers. And although they talk about integrated America, churches are still pretty segregated. There are many all Black churches and many all white churches, and how Black people worship compared to white people is very different. I've been to a lot of different venues, so I am feeling rather uncomfortable thinking about what it is doing to the mental psyche of a people who have so few avenues to even exert any sense of leadership, any sense of authority. When that gets taken away from you, what are you really doing? You're reducing that person to a very uncomfortable neurological state, in my opinion. It's not healthy.
So that is a for us, that's not just churches are closed. There are ramifications of that we should at least be aware of within our families.
Yes, it's bigger than just going to hear the preacher preach. It's bigger than just putting on your Sunday clothes. It's a moment where you exert a certain kind of authority. If you are a deacon, you are somebody. If you are an usher, you have some authority. If you're singing in a choir, people look up to you because of your achievement. When you don't have anything to feel proud of, and you're beat down, you don't have money, you don't have food, you're not allowed to move freely, to me, that's catastrophic. They're always talking about counselors coming in after a trauma. They're creating a trauma and don't seem to understand it. I would advocate that churches that want to hold church should get test kits and test their people when they come to service. And that way they can continue having what is necessary for their healthy psyche and not be condemned because of the fear of outbreak. Our community should be demanding tests for those reasons. I said back in February when I was talking to some friends, we need to have a testing center that's in a Black neighborhood. We need a community-based group that is keeping our people safe and keeping our psyche healthy. And if the folks need to go to church, let them test and go to church. They won't be defying the governor if they got a free, clear testing.
Okay, and before we allow you to go, back to the wisdom table, Stu, Doug, are there any closing questions or comments?
Well, this is me, Doug. I just wanted to say thank you, Dr. Boles. I just went in and gargled with salt and water while you were talking. That is no lie. And my son came in and said, "What are you doing?" I said, "You heard what she said. I'm gargling." And I'm headed to the store right on the corner to get some lozenges and onions and water and stuff, because I'm taking what you're saying seriously. And I hope that, Brother Leroy will bring you back again so that we can continue the conversation.
Thank you so much. And it is important, folks. I was talking to Brother Leroy earlier, and they're saying, "Dr. Boles, you're coming back clinical. We can do this." And I said, it's not that I'm rich, but I don't need your money. I need a reason. And my reason for talking about clinical health is I want my people to understand that when you're hearing stuff on the news, they may not have you in mind. So just because they told you this, the next question is, how does that affect the Black community? And we need people asking that question. But no one seems to be. They just say, here's what you do and here's what you don't do. And I keep saying, is that applied to everybody? How does that affect my diabetic clinic person who has also on dialysis? How does that affect her? What are you recommending for her? So we need to not just hear the news. We need to listen and digest what does it mean to the Black community. If you're quarantining me, how do I get fresh fruit? How do I get fresh vegetables? Because I live in a food desert. There's no grocery store in my neighborhood. How can you quarantine me?
Dr. Boles, this is Stuart. Can you hear me?
Yes.
Yeah, I would like to just, a little more, and I like for us to be able to codify some of the food and vitamins and supplements that we should be stockpiling if we can in the event of the possible quarantine that you're talking about, where we are not able to get to the store. What items should we gather in our homes that are non-perishable? I understand all the fresh food, but what about non-perishable that we can stockpile to help boost our immune system and to feed us in the event of inability to get to the store?
Okay. The first thing, get the idea of supplement out of your mind. Supplements help you when you're healthy, or we have become a country that thinks you can take a pill and make it all better. If you really want to fight the virus, you want to strengthen your own body. And in this case, food is medicine. So what foods are you targeting? Non-perishable. Canned fish, if you can get sardines, if you can get salmon, if you can get mackerel. So any of your canned fish, not your canned pork, not your canned chicken, but fish. Why fish? Fish in oil has what the body needs from an energy point of view to launch a battle, particularly if you're talking against viruses, because you have something called a killer cell. And that cell in your body needs certain kinds of enzymatic nutrition to be able to take care of antiviral situations. So what would I recommend? Canned fish. You should have tuna, you should have sardines, you should have all your different kind of canned fish. What is the next one? Any kind of greens that you can get that is, it can be frozen or canned. If you don't have a freezing capacity, go with the can. And you want to get your collard greens or your mustard greens or your spinaches. Why am I saying this? Vitamin A is a big component of making the body's immune system, particularly in the gut, because we have a immunoglobulin that is an IgA. So we need to make sure we have really deep green vegetables. So whatever you can think of, you like the collards, mustard greens, whatever, deep green vegetables. If you're going to buy them in the can, if you're buying corn, put the corn back on the shelf and get something green. That's the kind of stuff you want to have on hand in the event your family gets an infection, because this is your secondary immune system. Number 3, what are you looking for? Anything that has been fermented. That would be sauerkraut, that would be kimchi, even pickles has this role, because your gut that has what we call beneficial bacteria, it can be fed with any kind of fermented food. That would be yogurt, anything yogurt is fermented, buttermilk. A lot of people don't drink buttermilk anymore, but it's buttermilk, sauerkraut. So those are the foods you want to have, because once you have an infection, or if you're at high risk for infection, you want your secondary immune system boosted to the max. And those are your boosting foods.
What about beer?
It's a lubricant. It's also diuretic. So the risk of drinking.
Thank you, Doug.
You're welcome, Stu. You're welcome, Stu.
Thank you, Dr. Boles. That answers my question. Thank you.
Doc, going down the list as we allow you to go, apple cider vinegar.
Well, there's different kind. You want to be careful that the Americans have made vinegar out of petroleum. Much of the white vinegar that you see on the shelves is not apple cider vinegar. So you want to be sure that you see that it says apple cider vinegar, because most of the vinegar sold that's cheap is not apple cider. Apple cider vinegar in most stores are a little bit on the expensive side. Apple cider vinegar has a lot of medical benefits that plain vinegar does not. So you need to know they're not the same. One does not equal the other. If you are talking just a gargle or sore throat, it doesn't matter whether it's apple cider vinegar or not. If you're taking it because you want it to activate your nutrition system, then it should be organic apple cider vinegar. So it depends on the use. If you're using to clean surfaces, and yes, you can clean a surface with a vinegar mix and it does dissolve or dissipate the virus, you can use any kind of white vinegar. So if you're using it for consumption and health, definitely you want apple cider vinegar. If you're using it for cleaning reasons, it really doesn't matter if it's apple cider or not.
Pomegranate molasses.
Ooh, you would love to be here with me, brother. I got some pomegranate covered in dark chocolate, and it's delicious. Pomegranate has an amazing immune boosting. It has a lot of the echinocins. It has your vitamin C. It does have some vitamin A. So pomegranate is wonderful if you can get it. It's not widely available to everybody, but yes, it is a wonderful immune booster.
Okay, so we're at the end of a very, very informative session with you, Dr. VELBA Boles. To Brother Doug, in terms of this being on YouTube, how is it going to be labeled? Dr.
It's on YouTube. It's on YouTube right now, and it's Wisdom Table with Dr. Boles, March 27th.
All right, very good. So that's where folks can access the show and have their friends access the show after this evening. Dr. VELBA Boles, may God continue to bless you and your family. Thank you very much for your assistance and your sharing information that we otherwise would not be getting if it weren't for this community radio station, Grand Houses Community Radio. And we also salute the station on the east side, which is the James Weldon Johnson Houses Community Radio. Thank you very much. God bless you and your family.
Okay, as always, I enjoyed it. Thank you for the invitation, and this is what I'm all about.
All right, peace.
Bye now.
Ladies and gentlemen, this has been the Wisdom Table coming in from Harlem, USA. We thank the Most High for blessing us with the opportunity to serve you with information. Ask you to pass this information on, but do research that which you heard today, and you'll be much smarter. God bless you all. Peace.